Good morning from Boston, and good afternoon and good evening to those of you who are joining us from all over the world, from Egypt, from Iran, from Saudi Arabia to Oman. And we even have folks joining us from the US and countries in Europe, and from as far south as Brazil and as far east as Singapore and Beijing. I'm Bob Dietrich. I'm the Associate Vice President of National Advancement at Northeastern, and it's my pleasure to welcome you to this evening's program, Community, Conversation, Connection. I especially would like to thank our leadership team of the UAE community, as well as the Northeastern Young Global Leaders for mobilizing their networks to make sure that this program is a success tonight. At a time when we are physically distancing from each other, coming together as a community in new and innovative ways and through social media and through platforms like this is more important than ever. This evening's program is one of a number of events being held in communities all over the world, where alumni, parents, students, and friends can come together to stay connected to Northeastern and stay connected to each other. Tonight, I'm joined by three of my colleagues from Northeastern: Diane MacGillivray, Senior Vice President for University Advancement; Camplese, our Chief Information Officer; and Sternberg, Distinguished University Professor Alessandro Vespignani. Together, they will talk to us about how Northeastern is responding to, and indeed leading in these unprecedented times, how we are reimagining how we teach and how our students learn, how scientists and researchers are leading efforts to address the challenges that the global pandemic has put before us. I'm going to turn it over to Diane in just a moment to introduce our other speakers, but first, a few logistical details. In order to assure a smooth program today, we've disabled mics and videos, but the last thing we want to do is mute you. So we've enabled two features of this platform, that is chat and Q&A. We ask you to please post comments, suggestions, feedback in the chat room, and use the Q&A to post questions that you'd like to present to our speakers. Our program is scheduled for 1 hour, and we'll begin by my colleagues sharing their thoughts with us, and then we'll follow with the Q&A session. Again, please post your questions at any time throughout the presentation and throughout this hour-long program. Finally, this event is being recorded, and we'll put it up on our website following the conclusion of our program. It's now my pleasure to introduce Diane MacGillivray, Senior Vice President for University Advancement. Diane joined Northeastern in 2007 and leads the university's efforts to build strong and strategic ties with our alumni, parents, and friends. Under Diane's leadership, the university's Historic Empower campaign raised $1.4 billion, surpassing its goal of 150 million. She also spearheads special projects such as Northeastern's Women Who Empower program, the Global Leadership Summit, and other strategic initiatives for the university. Diane, I'll turn it over to you.
Great, thanks, Bob, and thank you to my colleagues, and thank you to all of our alumni, parents, friends, students who are joining us. It's great to be with you. I wish I could see all of you. We miss you all so much, being able to be together in person to do programs like this. First, let me say I hope that you are well, that your families are safe and well. And I am excited to be joining you here today from my office on Northeastern's Boston campus in what is a slow reopening to what we are calling the new normal. And as we prepare to welcome back in the next few weeks about 400 co-op students into our residential facilities, we're working really hard night and day, as Cole and Alex and others know, to make the fall experience one that is memorable, special, fulfilling, and one in which Northeastern continues to fulfill its teaching and research mission. All of that knowing that what is fundamental, what is paramount, is the health, safety, and well-being of the people who are in our community. So what I can tell you is, if you were here with me when I came into the office this morning, you'd see people wearing masks. checking into our Safe Zone app. You'd see markers, social distance markers in front of the elevators, at some of the tables where students study. But you would also see a campus that is absolutely just as stunningly beautiful and as warmly welcoming as ever before. So while many, many things have changed and things will continue to evolve, the thing that really has not changed, as Bob said, and as you'll learn more about, is that mission of discovery and learning and teaching, and those things that make Northeastern distinctive, differentiated, and a place that you can turn to, that we all can turn to for solutions, for advancement, for new ways of thinking about the world, and those kinds of things that are going to make the world the better place we so desperately need it to be right now. As I mentioned to Cole earlier, innovation is coming fast and furious, and faster and more furious than maybe some of us can even imagine handling it. And we're going to talk to you more about that a little bit later. I'm really thrilled to be able to have Cole share with you some things that he's been spearheading, working on, that I think are game changers, not just for our students, but for all of you in our wider Northeastern family and community. But first, I'm honored to have the person who is our real headliner today, and that is Professor Alex Vespignani. Alex is the Sternberg Family Distinguished University Professor and Director of our Network Science Institute. He has appointments in the Corey College of Computer Information Sciences, and in the College of Science, and also in the Bouvet College of Health Sciences. So for all of you alumni out there, he hits a lot of our colleges. His research includes complex systems, networks, and the data-driven computational modeling of epidemics. So as you can imagine, he has been a very, very busy person over the last several months. His work's been featured on countless news outlets, from the New York Times, National Geographic, Bloomberg, The Economist, to name a few. As importantly as where he's been featured, it's what his work has done to inform decision makers, policy makers, governors, mayors, and even the White House. And indeed, he has been informing our management team since early February, I believe. And what you may not know, Professor Vespignani, is that every time you are slated to appear virtually at one of our management meetings, there's a moment of anticipation that precedes it, and a little bit of a hush that comes over the virtual meeting room. And then we all say, Alex is here, Alex is here. And we hang on your, we really do hang on your every word, because you, as much as anyone, really have been looking to help us understand how this epidemic is impacting the world, the US. So if we could just start with you telling us a little bit about where we are today, your assessment, maybe starting in the US and looking at the world. I know I woke up to headlines that weren't particularly encouraging, but we'd love to hear some of your expertise.
Well, thank you very much, Diane, and thank you for the very kind presentation. You know, the work we are doing is when we talk a lot at Northeastern about trying to do research that finally is actionable and have impact, I think perhaps what happened in the last month is a very good example of it. You know, what we did and prepared for many years was then delivered to all the agencies and people that could use this information to fight COVID. The situation now, it's how to say, as you say, is there are good news and bad news at the same time. First of all, unfortunately, worldwide, this is a moment of expansion for the pandemic, and so probably many of you have read of news from Latin America and other places where unfortunately we see large number of cases and a lot of fatalities. At the same time, we have good news from countries like New Zealand, Australia, that were able to actually to apparently eradicate the disease. And that's really very good. It's possible to bring down the cases to zero. It's a situation perhaps a little bit easier for countries like Australia and New Zealand because of their kind of island perspective. When you really close your traveling patterns from the rest of the world, then you can focus internally and eradicate. It's more complex for countries like the US. Europe had a very, what they call it, they hammered down the epidemics. So they were imposing very strict lockdowns for several weeks and actually months. And now there is a decline all over the places. Also that's apparently we can consider good news. The situation in the US is more of a patchwork, unfortunately. And some states are on a very good trajectory. Some other states instead are on trajectory that sees an increase of cases and fatalities and alert for the healthcare systems. States within the US have reacted differently, have used different lockdown measures, and I think at this point we see those differences a little bit reflected in the evolution of the epidemic. One good news that I think there is more and more evidence is that the summer and the temperature, the environment of the summer in the Northern Hemisphere is going to help the fight. That unfortunately also implies that we will have to be very careful in the fall. And there are different names that now experts call what we have to do in the next months, especially in the fall. Some call it the dance, other the tiptoeing. So in a sense, we will have to go to, and Diane, you were saying in an eloquent way, you know, we go back to normal, but it's a new normal. Mm-hmm. So it's a normal in which we have always to keep the eye open, to be alert. That doesn't mean that we cannot go back to normal. We must go back to normal. And I'm trying to tell everybody we can't obviously be in a lockdown until a vaccine is available. That is not going to work. But we will need to be alert. We will need to be responsible. Each one of us has to do his or her job. And this is something that, you know, when somebody's asked me about what is your job, and I say, you know, in a sense, I'm the weatherman of epidemics. We are trying to make forecasts about the where, when, and how much of an epidemic. And however, we have a major difference from the people who do the weather forecast. When you have a hurricane, you do the forecast, and the hurricane doesn't care about the forecast. So it will follow its trajectory and will strike as it wants. For an epidemic, actually, we can change the trajectory of an epidemic. What we do as government, what we do as agencies, what we do as even single individuals can change the trajectory of an epidemic. And I think this is one of the most important message to tell people. It's not just a matter of what the government do or say, but is what we do. Do we wear masks? Do we avoid crowded places? Do we try to think about our elderly and try to shield them? You know, these are all the important things that we will have to, in a sense, keep in mind as a new normal in the next few months. And you know, again, forecast and all the computational approaches that we use are not, for this reason, are not to be seen as oracles or unquestioned oracles. You know, what we do offer, you know, different future, possible futures that depends on us and what we do.
You touched on this a little, and I'll invite people to ask more questions in the chat along with my colleagues. But, you know, we've been understanding, I think, that this is something we may need to learn to live with, that this new normal is going to be with us for whether it's, you know, 6 months, 12 months, or it's endemic, that this is really going to have to kind of change some of our our behaviors, the way that we approach our lives, our work, because, you know, a miracle vaccine may come, but it may not come. It may not come quickly. It may not come at all. Do you think we're going to be living with COVID-19 for some time to come?
Well, you know, it's not a matter of if, but, you know, we will have to live with the virus for some time. It's how long, and there are different ends that we can imagine for this pandemic. One for sure is, you know, a vaccine, and I'm really hopeful and optimistic. I know that many of the colleagues who are biologists and labs around the world, they are all scrambling to get a vaccine on the production line. But it will take some time. So it will take months. And so that's why we see, and we try to see one step at a time. And so the next thing is, okay, during the summer, and then what after the summer in the fall. This is a vaccine is unlikely to be available on large quantities before the next year. So, but I'm optimistic that will happen. The other things that might happen, that we are getting, and we see that we are getting better at that. You know, our colleagues, our people, and I always say is the heroes that are on the front lines, the medical doctor, the nurses, the healthcare givers. You know, there is so much improvement in the way we can treat patients, the knowledge of what to do with people needing critical care, that you see that in many places, the number of cases is going up while still the number of deaths are going down. And that's because of, you know, we are better at treating people. We are better equipped. We understand more. We know, again, to shield the people who are at risk. And so that, you know, in a sense, the first wave really took us like a storm, and we didn't know what was going to happen. And now we will be much better in the future months. And so that's, again, is to have a positive outlook. I think this is important. There may be also, you know, the more people gets infected, the more the virus has a hard time in spreading in the population. That also means that it will reduce its growth rate and spreading capabilities along the future months, and that also is something that I think is a positive outlook. So, in a sense, I can't imagine, you know, even if it will become endemic at a certain point, people say, oh well, it will become endemic. Well, it will become endemic, but a very large fraction of the population will have the immune system to coping with it. The virus will affect a very little number of people during the year. So it will be a different story. For now, you know, now it's the emergency of a pandemic, when you have that most of the people in the world is susceptible to the disease, and you really have to protect the healthcare system from being overwhelmed. That's our fight has been our fight for the past months. And now we have just to be better and not let that happen again in the future. Hopefully without going back to very severe lockdown measures, because let's also say that economics and all the other things are very important. Every time that we lock down a country, there is an immense number of drawbacks and problems that are generated by that we want for sure to avoid. So I want to give some glimpse of positive outlook for that. I think in the next few months we will be much better equipped against the virus, and this fight is a fight that we will win. We are going to win. There is no way that we are not going to win. We just have to do, everyone has to do our part, and we will do that.
That's extremely heartening and encouraging. So thank you for that. I'm going to switch gears just a little bit, and then as we have questions, come back. As you've heard, we're here with a number of our alumni, parents, students from all over the world. And one of the things that we're all really proud of is that our network science group, which you lead, is the leading group in the world in what you do. So could you just explain a little bit, what is network science?
Well, network science is the science that try to understand and describe and put in mathematical terms that we can use to have actionable prediction and understanding everything that is network. And network is all around us. Well, first of all, we have social networks, we have technological networks, we have infrastructure networks. These are all the networks that we have engineered to be networks. So there are computers connected, there are substation of the electric grid, and this is all what we can immediately recognize as networks. But then there are networks like the social network. So a disease, for instance, when we talk about COVID, why we work on COVID is because when we talk about COVID, COVID is spreading on our network. What is? When we meet, when we are in the same place, when we talk, when we are in close proximity. This is the network of human contacts, and is what makes great our society, you know, the way we interact, the way we talk, we exchange ideas. Well, you know, unfortunately, COVID spread on this network. And this is why we do the lockdowns. This is why we do the social distancing, is to fragment this network. And now imagine, you know, network science is a science that can tell you, well, how we measure those networks, what characteristics they have, how can we fragment better this network if we want to stop the spreading of a disease, or how we can create a better network to spread knowledge, innovation, information. So this is the way that we work, how we create resilient networks. You know, when you think about a computer network or when you think about the power grid, you want networks that even if you damage those networks, they keep working and they keep delivering their energy or information or the emails on the network. Well, how can we design networks that are more resilient to any kind of damage? So this is what we do in the Network Science Institute, and this is why we have a very interdisciplinary institute, because networks are important from political science, social science, to disease spreading, but as well, you know, infrastructure, engineering, biology, our cells, you know, our protein interaction network, genome network, all these that happens in our body happens because of a very complex network of interactions. And so, you know, we study and we use network as a thread across all these areas to provide understanding and science across disciplines. And that's what we do. At the moment, we are doing a lot of work on COVID, but, you know, hopefully, you know, we will go back into the new normal or normal and go back to many of our interdisciplinary work and research.
I remember at a Facebook Live event you did with President Aoun a few weeks ago, he asked you, and we have a question on the chat, how does one become Alex Vespignani? What did you study and how did you come to be?
It was a very strange trajectory, and I think I was trained as a physicist. I was working in physics, in condensed matter. Networks in that area are important. Is how atoms connect together, how materials are done, and so I had an interest in network. But then I stumbled into a paper by another colleague from Northeastern University now, that is Laszlo Barabashi, that was one of the father of network science, and he was showing the beautiful complexity of the internet network. From there, I moved into computer science, and then, you know, computer, I've been in computer science working on social networks, and I got interested in computer viruses. At that time, I'm talking about several years ago at this point, the computer viruses, many of probably the young person here don't remember, but we didn't have internet. You had to give what we were calling the floppy disk, do you remember? And really, if you wanted to give code or data to another person, you had to have this physical network. And the virus on computer viruses were spreading really like biological networks. And so from there, some colleagues of mine told me, why don't you apply this knowledge also to biological networks? And so 20 years ago, I moved into public health. And now this is what is most of our research activity about.
Someone submitted in advance the question, what kind of data do you use? How do you collect all this data that you use for your model?
Well, there is plenty of data that we can use, and some of the data are collected previously, because that one of the problems is when you are in an health threat is that you enter what we call the wartime mood, in which you really have to do everything very, very quickly. So there are data that goes up that are related to epidemiology. So the number of people who are sick, the number of people who are into hospitals, that comes from the surveillance system of the Center for Disease Control of each country. And then there are data like mobility data that we can get collaborating with, for instance, with mobile providers and companies that can access data about how we commute, how we go to places. We also tap into all the digital data, like, you want to know how people travel across the world. Well, the International Aviation Association can provide you all this data. And so this is the big effort that we do in our modeling, to integrate all data and extract from those data our insight and knowledge about what will be the pattern of the epidemic.
So I just, before I ask the next question, I do have to note, if you don't see it, one of our alumni from Italy says, Italy is proud of you, Professore.
Oh, thank you. Yeah.
Because we do have a global audience with us today. I mentioned, and it was almost in passing, and it shouldn't have been, because it's very important, the work that you were doing to be part of the group informing the White House, governors, mayors, et cetera. And one of our audience members has asked, could you give some examples of some of the entities or the people that has been using your research, your work to help inform policymaking?
Well, I think, modeling is something that is used when you navigate in the dark, especially at the beginning of this pandemic. And I'm sure Diane remembers those days. You get an outbreak in China. This will get to the US, will get to Europe. What's going to happen? How we prepare? Do we really have to plan for a complete shutdown, or we just instead put? And so this is initially you are quite in the dark. You have a new virus, you have a new threat, you have data coming from other countries, how much you can trust, how much you can assimilate those data. And the modeling is trying to do what we call situational awareness initially. So, well, what is the extent of the outbreak in those places? How much we have to be, how we evaluate the risk of getting here and there. And so this is part of the initial work. Then the more data we have and the more we get into the, what we call the scenario analysis. And so you say, well, at a certain point in February, we knew that this was going to be a major pandemic, although we didn't have yet cases ramping up across the world, but that was clear from the data. So at that point, you start to develop scenarios. Scenarios are, you use assumptions. You say, well, what if I lock down a country? What if I just tell people not to go to places? What if I just close schools, et cetera, et cetera? And these kind of what if scenarios are offered to the policymaker, to the people who made decision. And this is very important because, modeling will never tell you do this or that. You have always to evaluate all the trade-offs, and the trade-offs are economical, the disruption of life of people. And so at the end, the policymakers have to make very different choices. I respect a lot their work, because they found modelers telling them, you know, the things could be from this worst case scenario to this best case scenario. What we do, and they had to take decisions that are very, very, very tough based on that, based on the risk that they assess, the resources, et cetera, et cetera. So this is all that happened. Then at a certain point, when you know the decision, you can start to do the actual forecasting. So, and try to say what will happen in the next week, in 2 weeks, 3 weeks, 4 weeks. And this is something that we are doing on a routine basis in the US. So this is all the information that we provided. And I have to tell something, really, for this pandemic, science has reacted in a way that is wonderful. You know, immediately large networking among all modeling groups across the world. The agencies have been part of this response, have been providing information. And obviously, you know, nobody's perfect. There have been changes in understanding the disease along the way, and we have to correct things, etc. But I think at the end, having modeling was helpful in having information to make decisions. And hopefully we were able, you know, in all this process to avert cases and save lives.
That's, Bob, I'm going to ask you if I can change it up a little, and if we can open it up to maybe for some additional Q&A with Professor Vespignani, and then we'll let him go do his important work, and Cole and I can kind of pivot, but want to make sure that everyone gets a chance to ask Alex anything that is of interest to them, because this is a really special opportunity to have you, Alex. We know how busy you've been, and we really appreciate the time you're giving to our community today.
Of course, Diane. So,
how are we doing the Q&A beyond the chat, or is it all in the chat?
It's all in the chat, Diane.
Okay. All right, Bob or Cole or my other panelists, do we have any other questions for Professor Vespignani?
You know, Alex, just listening to you now for maybe the 15th, 20th time, every time I do, I learn. And very early on, you came and spoke to the cabinet, and you warned us in early February that this was going to be real. And I walked out of there calling my wife and saying, find as many N95 masks as you can. But I'm curious, as you talk to people about this in early stages, and you knew the depth of what was coming and the waves that were coming, how did people around you react, given sort of the news cycle that was saying that this isn't really anything?
That's a tough question. You know, yeah, you remember, you know, since mid-February we were telling, you know, this is going to happen. I even remember at a certain point, you know, one of the first country that was hit by the pandemic was Italy, and the other countries in Europe were still not, you know, saying, well, we have to isolate. And I was telling everybody, look, guys, this is going to be everywhere in 2 weeks, etc. You know, people were obviously looking at those as forecasts and say numbers, and numbers have a probability attached to them, like weather forecast. And everybody was saying, are we really sure of that? Is this really happening? The first reaction. I think among the modelers and the people in the response teams of this, how to say, in understanding the pandemic, there was no, there was the acceptance of that. At the policy making level, there was initially more hesitancy. And I can understand why. Everybody's telling me, well, are not you, why the government didn't act before, etc. Well, I always try to convey this message. When you do the weather forecast for a hurricane, you have also this, you say the hurricane will have a touchdown, it will be category, whatever, etc. But you have also a ominous photo from a satellite that shows you the hurricane. And the people knows that this is going to be real. When you have forecasts for disease threats, well, you are saying, look, you have spreading, but you are not seeing it yet. And and you don't have that photo. And you are telling people, well, you know, in 3 weeks, you will have thousands of cases and the hospital rooms overcrowded. But you don't have something like that is as much tangible as that picture. And if you are in a decision maker position, put yourself in the shoes of a mayor or a governor that without that picture has to say, well, let me shut down the city. That's really very, very tough. And so you start always to say, well, let's wait a few days more. Let's see what happens. And that is what generally has happened all across the world. I think now there is much more understanding that that kind of analysis have to be considered also if you don't have that photo, and that I'm confident that next time there will be more an earlier reaction to what is communicated. But it's something that I've seen repeated all over the world. No places has been acting differently, with a few exceptions of countries in the Far East, like if you think about Hong Kong or Japan, that were countries that were really still at the scar of the SARS in 2002. And so they had that experience internalized in a way.
So we had a question that came in about, the question is, we've heard so much about mathematical models now. There seem to be dozens of different models we're using to understand the spread of COVID. Many of them are giving different projections. Can you say something about whether the differences across these models, and are there broad classes of models? Are yours different or similar, or how can we sort of understand that?
That's getting to you see that the audience wants to get technical, some meat in a sense. And well, there are different kind of models. There are two major categories. One is what we call more machine learning, artificial intelligence models that basically harvest a lot of data. Through artificial intelligence, you try to find correlations and then to project according to certain indicators. The system is learning through the past and then projecting to the future. And then there are models which we call mechanistic. So those are models more closely related to what you see for hurricane forecasting, which you really have equations that describe how the disease spread in the population. You describe and have data on how people travel from one place to another. And then really you go down to the level of the single individuals. So those are different categories. Then models from time to time will tell you different things. You will be surprised to know that that happens even for weather forecast. When you have the hurricanes, there is the famous US model, the famous European model, and then they have different, you see those spaghetti models that somehow they diverge and go in different directions, because it's the way you assume and treat the equations and the basic assumptions of the model. So that is part of it. So for instance, I could do a model that considered that the masks will be worn by people, everybody will be compliant with that. Or I can have a model that tells, well, no, just 50% of the people will be compliant, or this compliance will go down in time. And so those models will provide different scenarios, might have different assumptions. And so you have portfolio of models that will tell you different stories. And this is why when you do the scenarios, you have to be very careful, in the sense that the policymakers always has a range, a big range of outcomes to consider. While we do the forecast, for instance, now there is a National Center for Disease Control forecasting exercise. In that case, you use multiple models, exactly like in the hurricane spaghetti models, in which you see all those spaghettis and then you combine them to have a cone of uncertainty. And generally, the outlook you have is for the next 4 weeks, because if you project more far away, things gets shaky. It's like if I tell you if it will be snowing or not next December, you will tell me, Alex, what are you saying? Come on, yeah, it's the same. So that's why you see many, all this ecology of modeling networks out there now.
Terrific.
Professor, I'm sorry. Professor, I was wondering if you could comment on testing and how that impacts your models, because at least early on, there was a great shortage of tests. So the cases, I think it was generally accepted that the cases only that were from testing only represented a fraction of the actual cases that were in the population.
Even now, you have to consider that many cases slip through the cracks. That's a general rule of epidemiology. Confirmed cases are always generally the tip of the iceberg or a fraction of what really is out there. If you think about United States, there are probably areas which have more than 10 or 20% of the people that have got the infections. And these are big numbers that obviously are not reflected. And that's all over the countries. One of my epidemiologist colleagues once told me, you know, the rule of thumb is that you take what you see and then you multiply by 10, and then you will be close to what it is. It's not always that the number, it can change, but this is it. At the beginning, unfortunately, no country had enough resources to do extensive testing. That's one of the major issue. And so the disease was spreading in what we say invisibly, because, you know, the testing guidelines were just if you had a travel history to China or to a few specific countries. And so people that didn't have that history were not tested, but actually the disease was spreading. Now we are in a much better position, and that's another thing that how to say, that contribute to the positive outlook is that if we are able to bring the epidemic to low numbers, the capacity of testing and the healthcare system is going at that point to be capable of tracking cases, tracing cases, going after them and isolate them preemptively, and then reduce the spreading of the disease. So now testing is important, as well as the contact tracing and the work that is done in the hospital, and that is what makes us more optimistic for the future.
Professor Vespignani, someone asked noted in the chat, and oh, sorry, I was going to sort of wrap it up, but it looks like we have one more question that I'd like to get to. What permanent changes will the COVID-19 crisis make in our everyday lives, even after a vaccine is discovered? And what is the new normal? And that's related to what I was going to ask you and what was mentioned. We as individuals, you noted individual behavior makes a difference. What is that new normal, and what can we do, the Northeastern community, to continue to be a part of a positive move toward the defeat of this disease?
I think for the new normal is, as we said, try to follow directions from health agencies, from the government, try to wear masks, although during the summer will be probably not the pleasant things to do, avoid crowded places if possible, and do all those rules that we heard from day one. Wash our hands, try to, you know, we want to go back to the social life, but perhaps, you know, don't just, you know, have conversation with everybody in close contact. We can talk, you know, perhaps a few feet apart if you don't know what is that person. And then, you know, this doesn't have to be permanent. Let's keep in mind that this is going until we understand better what is the trajectory of the disease, and eventually a vaccine or therapeutics that will help us in treating the disease. At that point, we can go back to a full normal life. What we don't have to go back is to ignore the risk of pandemics. We have been repeating in the last 20 years how much it was important to prepare for pandemic, to have a national, like we have a national weather forecast system, to have a national disease observatory and a national outbreak response system, etc. So to invest in research, invest in understanding, in knowledge, in preparation. That is where we don't have to forget in the future. But for our lives, I really hope that, you know, and we are all working to go back to a life in which we can shake hands, hug, and have dinner together as soon as possible. And we don't have to think that we are going permanently in a world that will not allow that. This is, you know, as I said before, we will win this battle. That's 100% sure.
That's wonderful. Well, thank you so much again for being with us today. We really
appreciate it. It was a real pleasure. Real pleasure.
We are,
Thank you.
So proud that you are part of this Northeastern community, and we're going to be part of the defeating this disease together. So thank you.
And really, Diane, the Northeastern community was incredibly helpful with us. It was so supportive. I can't imagine any place, that did such a wonderful job in putting our institute, our researchers, and also other groups across the university in the condition to fight at best this pandemic. So really, thank you very much to all the students that have volunteered, all the leadership of the university, the donors, the benefactors. Everybody was so supportive. It was really heartwarming to be in the Northeastern community. The Northeastern community has answered the call in a wonderful and completely exceptional way. So thank you very much.
Great, thank you. Thanks for being with us. I'm going to switch gears just a little bit to talk about, in our remaining few minutes, how we are looking to reopen in this new normal in the fall, where the name of the game is first and foremost health, safety, and well-being of the community. But also another fundamental thing we know that we're going to need to provide is an exceptional degree of innovation, personalization, and flexibility. And we're doing a lot of things, the things we call the prerequisites for reopening. And that includes the testing and tracing that Professor Vespignani mentioned. It includes the wearing of masks and the social distancing. It includes an incredible amount of rethinking of the residential facilities, and we've secured many more beds, rethinking the dining halls, cleaning and disinfecting, all of those things that you can imagine. I just was on a call yesterday, as I believe was Cole, about what move-in will look like. It's always been an incredibly energizing but complex undertaking. And the group that is, if you can imagine, just undertaking what a different kind of move-in would look like, will look like in September. I think you'd be very impressed and very proud. But much of what we're looking at in terms of how we teach and how we work in the labs will depend on innovations that will last beyond the period of this pandemic. And so I'd like to invite Cole Camplese to talk a little bit about how technology is first and foremost underlying all of this, but talk a little bit about how we're approaching that mission in the fall.
Great, thank you, Diane, and thanks for having me. And I'm not thrilled that I have to follow Alex, so I just want everyone to know that this is a tough act to beat here today. Like I said when I asked my question, we found out about this in early February, and we thought the work that we had to do to go into sort of remote learning was difficult. What we've discovered is reopening the university has proven to be 10 times that effort, and it's just been Herculean because we as a university, our ethos is around experiential learning, right? We're a very social campus and global network. And so to start thinking about how do you recreate this largely residential experience is complex. And our physical plant, our classrooms themselves, weren't prepared for this kind of universe. So, we've mentioned New Flex a few times. For those of you who aren't quite aware, this concept of New Flex has been put into place to allow for several things. One is social distancing. So our classrooms have to be de-densified, right? So if a room typically holds 50, maybe only 20 can be in that classroom. The hybrid aspect of this is allowing students to be in the classroom, but also be out of the classroom and participate. And that's really the important thing. We've talked about this before, that a great class experience is one that is about discussion and discourse and conversation. And typically when students are remote, they're largely removed from that, right? So what we've had to do is we've had to rethink our classrooms to bring the students that are in the room the same availability to the students out of the room and vice versa. So if I'm sitting in my residence hall and I'm not in class that day, I still need to be able to hear the discussion that's going on in the classroom. I still want to see a video feed of the students as well as the instructor. I want to be able to raise my hand. And so to be able to do that kind of stuff, we've really had to rethink our entire classroom design. So this summer, we're putting about 200 new classrooms in place that'll be ready for fall. Just an incredible, incredible effort by everyone on campus. But this is the only way we can envision doing this. And what's really fantastic in my mind is, you know, as Alex was so optimistic at the end of his conversation, we know that our investment today through this pandemic will yield a differentiating experience long-term for our students. So that's really exciting to me. The other thing that we learned very early on with the closure is that students were concerned really about three things. They were really concerned about their health and safety because news and misinformation was very difficult for them. So there was a lot of worry that they were carrying around. And we did this through a lot of the kind of work that Alex does through, you know, social listening, working with our marketing communications team to understand what they were saying online. They felt a real loss of the social connectedness because, like I said, ethos is experiential, but a lot of that and learning itself is a social endeavor. So when they left campus, what they left behind was, for example, their resident hall network. They didn't have that anymore. There was no online equivalent to that. They have Twitter, they have Snapchat, they have their personal social networks, but what they don't have is they don't have social networks for campus. So this fall, coming into this fall, we're putting into place a brand new university-wide communities platform that will have a digital component to every physical event, affinity group, or anything else that's going on. So that means if we do have moments where students have to leave campus or just stay in Boston or any place else, but for 3 to 5 days, all of that social interaction with their campus friends and colleagues continues. The third thing we heard really loudly was, although we believe students are extraordinarily digitally capable, they really do struggle to do the work that they're used to doing in person online. So for example, paying their bursar bills, right? When they're on campus, they have people to direct traffic, to reload their Husky cards. They have people to direct them. All of the things, the business of being a student is very complicated. So we've built something we call me.northeastern.edu. We call it a hyper-personalized single pane of glass that gives students views into their course lists, their calendar of events, their assignments. It surfaces all of their recent documents. It allows them to collaborate on the fly. It has a gateway into each of their communities that they're members of. They can add a moment into SAIL. SAIL is our digital platform for self-authored integrative learning where students reflect on their experience. It brings forward AI-generated recommendations of events and things to work with on campus. So again, when we start to talk about this quietly, when I do with my peers around the country, they're like, where are you buying this? And we're not. This is something that the university has chosen to invest in. And so on a very personal note, you know this, my daughter will be a first year in the fall. And so like, we're all excited, but we're also very nervous, right? So these are very personal decisions and work that we're doing. And it's so nice to have that N of one, the person at home, your target audience living with you, that you can say, what would you think about this? And she had to lose her senior year, right? And go online. She experienced all those same things, fear, social engagement loss, and then how hard it was for her to finish up her year as a senior in high school. She said, this would be a game changer for me, absolute game changer for me. One of the last things we're doing to manage this new flex environment is we're creating a dynamic and flexible scheduling tool. So students right from their student hub on a weekly basis can make decisions about which classes they want to be in the room to help us with our de-densifying classrooms. And then it gives them a dashboard that tells them where they're supposed to be and at what time. And it gives their faculty member a dashboard that says, this is who you'll expect in class this week. So there's an algorithm behind it that filters out the people that opt out and tries to establish seats for those students on an ongoing basis. So that's just a couple of small examples of some of the innovation that we're doing that, again, exceptionally powerful work to solve COVID. But I believe the new normal will be a very different way that we all work, the way that we all teach, the way we all conduct research, and the way all of our students learn. And so these tools will form a foundation for what I think is really the modernization of higher education in a lot of ways.
Thanks, Cole. You know, from the first moment I heard you and others really describing this possibility, I was extremely excited, not just for the ways in which it would enhance this fall and make the fall experience, no matter what happens, very different from what our students experienced in the spring, but also because of those innovations that will outlast the pandemic. Also, though, as a global community that we're engaging with on things like this today, we have thoughts about how we can even extend this out beyond our students, or at least we have, after Cole, you do all of the things that will keep you busy 23.5 hours a day between now and September, some thoughts about how that can connect our alumni affinity groups and networks around the world. Can you just say 2 minutes about?
Yeah, of course. That? So, you know, like we're trying to invent something new with a student focus in the fall. But that's just a 1.0 product, you know, a 1.0 product. What we see is we see a platform that will extend out to alumni. Right now, we're transitioning alumni to the Office 365 platform, for example, which will unlock the ability for all of them to have this kind of dashboard to manage their engagement. And we're building it so that it has an open API framework, which that means it allows it to really seamlessly integrate with multiple platforms. So from an alumni perspective, imagine being able to see all the things that are important to you based on the work that we're doing with you, right? Mm-hmm. So you have same kind of personalization, but around the work of engagement, if you will. So instead of the work of a student, it's around the work of engagement with the university in a two-way street. So we're not stopping with what we're doing. And we think this will be transformative to the way faculty engage as well as staff. So that platform, the goal is to be able to scale it to all members of the Northeastern community, you know, over the next year.
Oh, that's fantastic. Well, I think that everyone who's here with us today can see why we are so proud of our faculty like Professor Vespignani. But also, I mean, can you imagine another university that would have a head of ITS like Cole Camplese? We are so really fortunate and grateful to have you here. I thought that before. This period has amplified that by like 1,000%. I'll have to ask Alex, the mathematical model, that can tell how much I appreciate all the work that you and your team are doing. Bob, we are at 11:28, and can you wrap it up for us and tell us where we go next? We're going to continue to engage this community, not just today, but tomorrow and next week and for the future.
Yes, thank you, Diane. And thank you again for all of you being here and for your questions, your thoughts, your postings on the chat room. This, as I said at the beginning, is one of many different events that we're doing virtually to connect with our alumni, our parents, and our friends. So we hope in the Middle East and around the world, this will be the first of many conversations we will have. And in many parts of the world, we are also leveraging the talents not only of our folks here at the university, but also the talents and the wisdom of the leaders of the community. We're very proud of our alumni, of our families, and they have a lot to share with us. One of the distinctive parts of Northeastern University is our partnership with corporations and with the business world. And we have leaders of business all over the world, and we can learn a lot from them. So we invite you to continue to be engaged. Diane and I look forward to seeing you in person sometime very, very soon. I don't think my suitcase has remained so empty for so long over the last 3 months, but it really was wonderful to have so many of you join us, and we hope to see you again very soon. Thank you.
Thank you all so much.